Support for Radio Friends comes from Columbia Healthy Smiles, the dental office of husband and wife team Dr. Batson and Dr. Abe, offering comprehensive and customized care to patients of all ages. Learn more by calling 573-721-9039 or online at www.columbiahealthysmiles.com. Good morning and welcome to Radio Friends on Wednesday, May the 24th. As always, it's a pleasure to have you with us today. And I've got two of my favorite dentists with us, Dr. Phil Batson and Dr. Elizabeth Abe. Good to have you here from Columbia Healthy Smiles.
Good to hear.
The last time you were on, we were just going through a whole list of dental procedures that people deal with on a daily basis or on a 6 months basis, depending. And we didn't get it all done, so I'd pick up where we left off. We'll start with you.
Okay.
Phil, what are the early signs that we may have some dental problems or dental troubles in our mouth?
It could be a few different things. Some things are, puffy, swollen gums that, they maybe have a reddish appearance, bleeding when you brush your teeth, bleeding when you floss. Those are all signs of gum inflammation. As simple as a tooth having some hypersensitivity or an area of the mouth in general having hypersensitivity to maybe hot or cold temperature or to chewing or pressure. And then it can get, obvious signs that are, if you can see swelling of any kind or anything like that. But really the early signs are just some of those real early signs of inflammation where something might just feel off.
What causes canker sores in our mouth, on the roof of our mouth or on our side of our gums?
That can be kind of varied. Depends, a highly acidic diet sometimes, if, we're coming into time where people eat a lot of tomatoes, and they're growing them in their gardens. That high acidity can cause, gum and irritation. Sometimes it can be related to stress or actually a viral outbreak, a latent viral outbreak, and sometimes takes time to subside. So it can have some.
Is that like having herpes?
It's a latent, response to it. That most people get it when they're a child, and then it can resurface, during times of stress, during time, when immune system is decreased, and then those lesions can come up.
So, but that's nothing really to be overly concerned about when you get the canker sores.
Just to manage it, the pain management of yourself, and to take, if you are having sensitivity, you can do some warm saltwater rinses. You can put some, the Oragel or Ambisol on.
But it will normally clear itself up within a week or so.
Yeah, most times 7 to 10 to 14 days.
And it can come on your gums or on the roof of your mouth too, right?
It can be buried in the area.
Yeah. Okay, so the next thing is, how often should someone get a dental exam?
At least once a year. That is what we recommend. And it is important so we can catch things before they become a problem, or we also do like oral cancer screenings to just make sure that things are looking good and healthy. We typically do an exam on our patients twice a year. But I would say one at the minimum.
So a minimum of once a year. Twice a year would be good to have your teeth cleaned twice a year,
yes.
Right? So when you go in to have your teeth cleaned, that's when you also will get that dental exam along with the teeth cleaning.
Yes.
Okay. The next thing, you take dental x-rays, but a lot of people have concerns about overexposure to x-rays. Are dental x-rays necessary, and are they safe?
Yes and yes. The x-rays on the necessary part, they help us look at areas of the mouth that we otherwise can't see with the naked eye, and areas of the teeth and jaw that we can't see with the naked eye. So I kind of equate it to if you want a complete exam, but no x-rays, or you haven't had recent x-rays, it's kind of like the dentist trying to do an exam in a dark room with no lights on. They can't see everything they need to see. And then from a safety standpoint, they're extremely safe. The radiation emitted is extremely low. It's now most offices have digital film, or not even film, digital x-rays, which have decreased the exposure to minuscule levels. We have radiation that we absorb in our body every day in our natural environment from being out in the sun, plane rides, eating a banana even has radiation in it.
So, but the x-rays are not taken every 6 months, are they?
They're taken as necessary. So for some patients, if they're a higher risk factor, maybe every 6 months. Most patients, once a year will suffice. But it does depend on the risk factor of the patients. Do they have a history of cavities? Do they have a history of a lot of restorations or fillings that we need to check around and that we can't always see clearly with an eye?
Okay. So the x-rays, bottom line is x-rays are necessary. They're not dangerous.
Absolutely.
I remember in the old days, we used to put that great big, real heavy lead apron around you. And then they would click it. It would go tick, 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 and then they would have to go develop those films. Yeah. Now, as you said, they're digital and they just show up on the instantaneously.
And so that there tells you how much faster and quicker they are and how much less exposure there is nowadays than even we had in the past.
Okay, here's something else that this wasn't on the list, but I wanted to ask you because you do it to me. Why do you measure the gums? This is something that the hygienist has started doing, where she will take this little pick and measure my gums. What is the importance of that?
So it is measuring to see if you have any inflammation. It can also measure to see if you have any bone loss, which would indicate periodontitis, and it will also just kind of measure the general health of your gum tissue.
So do you do this to everybody or only certain people?
Yeah, so we typically do this once a year as well, at least. Anything from, like, if you ever hear the numbers being called out, 1 through 3 would indicate healthy gum tissue. And then anything above it, we look at, is it bone loss or inflammation?
Yeah, I was there a couple of weeks ago. She said no change, which was good.
Yes.
It's kind of like going into your primary care physician and they take your height and weight every time you go in. If you see them once a year, we want to make sure we're checking your gums once a year to make sure that, no significant changes are occurring.
Okay, we've got 20, 30 seconds left, real quick. Do teeth need fluoride?
We would say yes.
Yes?
Yes.
Don't we get enough fluoride in our water, or should we be brushing with fluoride toothpaste?
We should be brushing with fluoride toothpaste too.
And what about fluoride treatment at the dentist? Is that necessary?
Some people benefit from it more than others. It wouldn't hurt.
Okay. Yeah. So just check with your dental.
Yes.
Okay. Thank you. If you got any questions, you can give them a call at Columbia Healthy Smiles. That number is
573-875-7071.
Okay, or you're on the line.
Absolutely.
All right. Thank you so much for coming by, Dr. Philip Batson and Dr. Elizabeth Abe, Columbia Healthy Smiles. Remember, there's no pain when you go to the dentist. If you haven't been for a while, go. It will behoove you.